the traditional theory that has been, the main theory as to what happened was the colocalization theory. On the left, you have an schematic representation of a pancreatic acinar cell that is normal, and that pancreatic cell is producing these zymogens, including trypsinogen, which is the precursor of trypsin. And on the left side, you have the regular the cellular housekeeping system with lysosomal granules, which themselves contain enzymes that are capable of activating the zymogens, but they don't do it because they're packed in different granules and the two never meet in the cell and everything is fine. Versus on the right, you have an instance of an animal with pancreatitis where for some reason these lysosomal granules and zymogen granules fuse and create havoc because the zymogens, these precursors, are activated within the cell, and this eventually causes inflammation. So this has been the traditional model that has prevailed, let's say, in the last 60 years or so. In the last decade or so, alternate theories have come to the surface. One of them identifies abnormal cellular calcium signaling in the cells that in the pancreatic cells, acinar cells of people, or this mostly rodents with pancreatitis, right? And so the accumulation of intracellular calcium in the cytosol is going to be damageable to the zymogen granules and ultimately result in activation of their content inside the cell. Then another theory that was brought forth is the endoplasmic reticulum stress, which itself ultimately lead to a similar result. The stress is associated with ultimately a transcription of a pro-inflammatory molecules and then activation of the zymogen granules within the acinar cells. So different pathomechanisms, most of them have been tested in rodents. It is not sure which one is actually present in the dog, and it's also not sure what triggers this whole thing. What we know a bit about the pathomechanism, but what causes abnormal signaling of calcium, what causes stress of the endoplasmic reticulum, what causes potentially zymogen granules and lysosomal granules to fuse, we don't know.